All right, welcome to The Explainer. Today we are diving deep into a condition that works in the shadows, often for years until it's critically late. We're talking about cirrhosis, and it's so much more than just a disease. It's really the final, devastating chapter for one of your body's most essential organs.
So let's just start with a quick question. If you had to name the single hardest working organ in your body, what's your first guess? The heart, maybe? The brain? I mean, they're both amazing for sure, but the real answer? It might actually surprise you.
The answer is your liver. This thing is an absolute workhorse. It's like a non-stop biochemical processing plant that performs over 400 distinct functions. From cleaning toxins out of your blood to making the proteins you need to live, it just never, ever stops.
And, because it does so much, when the liver starts to fail, the consequences are absolutely catastrophic. They ripple through the entire body. And that's exactly what we're going to break down today. What happens when this unsung hero just can't do its job anymore?
Okay, so let's get right to the heart of the problem. We hear the word cirrhosis, but it's really important to get this. This isn't some illness you just catch one day. It is the end of a long, slow, destructive road paved by years of chronic damage and inflammation.
The best way to picture cirrhosis is to think of healthy liver tissue as being like rich, soft, fertile soil. While cirrhosis is what happens when that soil slowly gets paved over with hard, useless concrete. This scar tissue, or fibrotic tissue, it doesn't do anything. It just sits there, blocking all the vital pathways for blood and essentially choking the organ from the inside out.
So what's causing all this damage? Well, the main culprits are things that attack the liver over and over again for a long time. Chronic alcohol use is a big one. It's just a direct poison to liver cells. Viral hepatitis, particularly hepatitis C, can wage a quiet, decades-long war of inflammation. And what we're seeing more and more is non-alcoholic fatty liver disease, which is often linked to obesity. It causes so much fat to build up that it triggers that same destructive inflammation.
Now, this is where things get really serious. You see, a scarred liver doesn't just quietly shut down. No, its failure sets off this terrifying cascade of complications. It's like a dangerous domino effect that can bring the whole body down with it.
And it all starts with a plumbing problem, a pressure problem. That concrete-like scar tissue we talked about, it basically creates a massive dam inside the liver. Blood that's supposed to flow through smoothly now hits this wall, creating this enormous high-pressure traffic jam in the portal vein, which is the main highway into the liver.
And that traffic jam, that has a medical name, portal hypertension. This right here is the first and most important domino to fall. The pressure builds and builds until the blood has no choice but to find a way around the liver. It's forced into these tiny back road veins that were never meant to handle this much traffic. And these detours, they are incredibly dangerous.
This massive pressure backup leads to two immediate, life-threatening consequences, and we can boil them down to two simple words: flooding and bursting. Let's look at each one.
Okay, so the flooding is a condition called ascites. The pressure inside those blood vessels gets so intense that it literally squeezes watery fluid right out of them and into the abdominal cavity. This is why you see patients with late-stage liver failure with a very large, distended belly. It's not fat, it's fluid. And this massive fluid shift just throws the body's entire system into chaos.
The bursting? This refers to esophageal varices. Remember how the blood is forced to find those dangerous detours? Well, one of those detours is through the delicate, thin-walled veins in your esophagus. These veins are not built for high pressure. They swell up like fragile balloons, and if one of them ruptures, the bleeding is catastrophic. It is a true life-or-death medical emergency.
But this whole cascade of problems isn't just about plumbing and pressure. Think about it. All that blood taking a detour around the liver, what's the one job the liver isn't doing anymore? Detoxification. So now, all the toxins that the liver is supposed to filter out are just cruising through the bloodstream, heading straight for the brain.
And this brings us to the next domino, hepatic encephalopathy. This is a direct result of the liver failing its detox job. Toxins, especially ammonia, which is a byproduct of protein digestion, start to build up in the blood. When they reach the brain, they cause this toxic confusion, a cognitive syndrome that can range from mild personality changes all the way to a full-blown coma. And what's so terrifying is how it progresses. Stage 1 might just be subtle things. They're a little more irritable or they can't concentrate. By stage 2, you get clear confusion and sometimes this very characteristic hand-flapping tremor. Stage 3, they're mostly asleep, but you can wake them up. And by stage 4, They're in a coma, unresponsive, and their life is in immediate danger. So, okay, now that we understand the chaos happening on the inside, let's talk about the outside. What are the warning signs? What does late-stage liver failure actually look like on a person? Because many of these signs are a direct window into the problems we've just covered.
You can literally see the internal failures on the surface. Jaundice, that yellowing of the skin and eyes, that happens because the failing liver can't get rid of a substance called bilirubin. The easy bruising and pinpoint red spots, that's because the liver has stopped making the proteins you need for your blood to clot. And of course, you see the physical evidence of that pressure backup, swollen legs and ankles, and that severely swollen abdomen from ascites.
And just to put the risk from one of the major causes, alcohol, into perspective, the numbers are pretty stark and really surprising. For women, the risk for serious liver damage can start to climb with as little as 2 to 3 drinks a day over 10 years. For men, that threshold is higher, around 6 drinks a day. It's just a powerful reminder that these risk factors are not the same for everyone.
Okay, so I know this all sounds incredibly bleak, but medicine isn't helpless here. There are absolutely ways to fight back and manage these severe complications. Now, the goal isn't to reverse the scarring. That damage is done. But the strategy is to stop the dominoes from falling.
So to manage that flooding from ascites, it's a multi-step attack. First, you start with a very strict low-sodium diet, because where salt goes, water follows. Then, doctors add diuretics, you might know them as water pills, to help the kidneys work overtime to flush out that extra fluid. And in really bad cases, when that fluid makes it hard to breathe, they can perform a procedure called a paracentesis to physically drain liters of fluid right out of the abdomen for immediate relief.
And what about that bursting risk from the varices? The goal here is to diffuse those ticking time bombs. First, medications like beta blockers can actually lower the pressure in that whole portal system. If the varices look big and scary, a doctor can go in with an endoscope and slip tiny rubber bands around them to choke them off. And for the most severe cases, there's a procedure called TIPS, where they create a new channel, a shunt, right through the liver to let the blood bypass the blockage and relieve that dangerous pressure.
And finally, for that brain fog of encephalopathy, the treatment gets right to the root of the problem, ammonia. The main weapon is a drug called lactulose. It basically works by trapping ammonia in the gut and forcing it out of the body through the stool. You can also use special antibiotics, like rifaximin, to wipe out the specific gut bacteria that produce a lot of ammonia in the first place. But when the liver is just too damaged and all these management strategies are no longer enough, there is really only one definitive solution left, and that is a liver transplant. It is the most effective treatment out there, replacing the scarred, failing organ with a new, healthy one from a donor.
So that's where we'll end. This whole devastating cascade of failure often starts in complete silence, with no symptoms for years, maybe even decades. And that really leaves us all with one final, pretty important question to think about. Your liver is your hardest working, most silent partner in health. Are you protecting it?